The different classifications of obesity are primarily centered around BMI. So there's a class 1 associated obesity, which is considered to be between a BMI of 30 to 34.9. Class 2 is 35 to 39.9. And then class 3 is anything 40 or above. Again, we could argue a lot about the validity of classifying obesity this way. And I think of it primarily as an insurance-based metric. Some of our companies who are deciding whether or not to add on medication benefits or bariatric surgery benefits might say, well, we're going to cover it for class 2 obesity, but not for class 1 obesity. When I'm looking at a person, when I'm talking to a person, the evaluation is much more complex than that. We're not just looking at BMI numbers or weight numbers. We're really looking at overall health. And most obesity experts would also be looking more globally than that, trying to figure out what is the right care for this individual in front of me. And, I'll tell you that the BMI criteria is quite flawed. If we look at someone like The Rock, Dwayne Johnson, right, he probably has a very high BMI, but he is packed with muscles. So if we look at him, he's technically probably considered to be obese, but obviously that does not seem to be the case. So obviously this is a very flawed metric, and these are, loose associations, but that is, again, sort of the metrics that insurance companies tend to look at.